Yay! All right, I'm going to say, I'm going to read my presentation, and I apologize for that now, but I have to. So, I'm Rebecca Hogue. My field of study is education, and more specifically educational technology, with a special interest in social media and the educational impact of blogging. I'm also an ePatient, a breast cancer survivor, a prolific blogger, as some of you know, because some of you follow my blogs. And today I'm going to talk about the impacts of breast cancer blogging, told in the form of educational autoethnography. So it's my story weaved in with survey results and comments from my blog. So here we go. It all began after a long bike ride. We just finished unpacking the last of my boxes. I'd spent the last year living apart from my husband. My husband commuting back and forth from Ottawa to Santa Clara, California. So I was living in Ottawa and commuting. I was so looking forward to actually living in California rather than just visiting it. And so just a couple days after having unpacked the last of the boxes, we went out for a long bike ride. And when I got back, I hopped in the shower. I noticed a hard spot on my pectoral muscle in my left breast. I thought that perhaps I had strained a muscle. Each day, as I got out of the shower and before I went to bed at night, I kept checking my left breast in hopes that the hard spot would be gone, but it wasn't. And after a week, on Monday, June 9th, at 8:30 in the morning, I called my primary care's office to see if I could get it checked out. And they had a spot open at 9:20. I love American healthcare for that reason. Didn't have to wait. I remember walking in all cavalier and saying, this is probably nothing, and I'm overreacting, but for peace of mind, I want to get this checked out. As my doctor did the breast exam, and she felt it, I could see in her eyes that there was something, there was a concern, and she put a referral in for a diagnostic mammogram, which is different than screening, right? So a diagnostic. My mammogram appointment wasn't until Thursday, but fortunately when they booked the appointment, they had put in the print at the bottom of the thing, you will get your results immediately. And so when I saw that, my husband came with me to the appointment, so I wasn't alone. So it was on that day, Thursday, June 11th, 2014, that the radiologist told me that I had breast cancer. From the moment I heard the words, you have breast cancer, I found myself yearning to blog. I didn't just want to journal my experiences. I wanted to write something that I could share with the public. I wanted to shout it out. This was happening to me. These were my thoughts that were running through my head, and this was my experience. I had all of these great witty titles for blog posts that were going through my head that first 3 or 4 days before I could get things set up. I began blogging a few days after the initial diagnosis, but before the pathology results were in. And so there was a few days there where I felt like maybe I could be an imposter. Maybe this is going to come back negative. Although the radiologist, I looked up the little BIRADS thingy, and it was pretty much 98% reliable kind of thing. So for a brief period, I thought I might be an imposter. What if it wasn't cancer? But the hardest thing I did the day that I found out was that I had to call my mother and tell her that I had breast cancer. And that was harder than anything, any conversation I've ever had, really. I was not ready for telephone conversations, but my family and friends needed to know what was happening. And of course, my family was all up in Canada and I was in California. I also had at the back of my mind that my blog could serve as useful data for research, so it never left my mind. Maybe even a new dissertation topic for me, because I was in the data collection phase of my PhD, and my PhD wasn't going to survive me not being able to travel back and forth to Ottawa. I wanted my experience with breast cancer to have some meaning. I was searching for some meaning in that. It didn't make sense to me to go through this journey without somehow sharing it so that others could learn from the experience. I also had a compulsion to write. I still have that compulsion. It is my therapy, but it's also how I think and how I get my thoughts through. So for me, writing has always needed an audience. I've never been good at journaling. I didn't ever really see the point of journaling for myself, but I've always written for other people. I was a tech writer before I went into academia, so I've always written for an audience to share. So I remember the first couple of days after diagnosis, before I started blogging, I remember the ideas that were popping into my head, all the great blog post titles. I remember actually asking my dad, so if I get treated at Stanford, does that mean I get to wear a Stanford sweatshirt? Not getting it on the page, I needed to blog. And as much as I felt the need to write my breast cancer blog, I couldn't read other blogs, and I thought that was kind of interesting in that process. I wasn't ready to join the community of women who blog about breast cancer. I wasn't ready to be one of the women who had breast cancer. I was ready to share my experience, but I wasn't ready to engage in other people's experiences, at least not yet. From the beginning, my friends and family provided encouragement in my blogging efforts, leaving comments like this one by Mahabali, who I met in person for the first time like 3 days ago in Manchester, which is really exciting. Rebecca, even though you may have created this blog for all sorts of reasons, I find it a kind of generosity that you've done so, both for possibly supporting others going through similar life events, but also for helping keep people who care about you up to date with your thinking and feelings when you are ready to share them, however you are ready to share them. Now, when I find myself thinking about you, I come here to see what you've been willing to say lately, rather than email or PM you to ask questions and you may not want to answer. And I found this type of comments on my blog very encouraging. I knew that people were reading it, I knew that people were seeing it, but they were also leaving me messages of support there as well. There was something I was going to call out here because we mentioned that. The generosity idea I thought was very interesting because that was the theme somebody mentioned yesterday in blogging, so I thought it was interesting that one of my quotes came up with that. So this encouraged me. As a blogger, I'm flattered when someone leaves a comment on my blog about how my blog has helped them, or if they share a Facebook comment about my post. This helps me keep motivated. It helps me know that there's value in my writing beyond my personal therapy. I've had many people also comment to me that my blog has helped them better understand what it means to experience breast cancer. I've had many people who have breast cancer tell me that my blog has helped them process their journey. So I keep writing, not only because I have to, but also because people encourage me to keep doing it. It was the comments on my blogs that others left that inspired me to look further into the impact of breast cancer blogs on those who have read them. In April 2015, I did an anonymous survey. I posted it across 8 different breast cancer blogs, so it wasn't just my blog, but 8 other ones as well. And it was advertised on Twitter using the BCSM hashtag and BCCWW. So the first one is breast cancer social media. It's mostly North America. The second one is breast cancer chat worldwide, which is a more global audience. Both had breast cancer communities. The survey was closed on May, so it ran for just over a month. Responses with no or blank in the consent to use data for research were removed from the database. It surprises me, people that fill out surveys and say no for consent. But anyways, I had to remove them. I removed them all, and I was left with 173 survey responses, which I thought was quite incredible for a survey that went on a blog. So one of the questions I asked was, who is reading breast cancer blogs? I wrote my blog primarily for myself and my family, so that they had regular updates, if not way too regular. In the early days, I was blogging 3 times a day, so there's a lot of posts out there. But I believe this is true for many who choose to blog their cancer journey. And yet, who reads breast cancer blogs? Mostly women, 93%, actually 93.6% are women. Other cancer bloggers, given that the bloggers represent a really small proportion of people who have cancer, the fact that 25% of them were respondents is a pretty high group. People who are not related to the blogger, and I thought that was pretty interesting too. So 93% of the people who were reading were not related to the blogger. And so the audience is actually much greater than just the friends and family that we think are reading our blogs. Others who have been diagnosed with cancer, 64%. And health professionals were only 7.6%, and I was really a bit disappointed there. I was, part of me, I came from a little bit of a background of medical education. I was doing some work with the Department of Family Medicine in Ottawa, and so I was a little bit surprised that there were so few, and that's an interesting discussion to have. In writing my blog, I hoped it can be used in some way to improve education. In addition to education of other cancer survivors, I'd hope blogging would help health professionals better appreciate the lived experience of the disease. So why do caregivers read breast cancer blogs? The first 3 months after Sure. For the first 3 months after diagnosis, I was unable to read breast cancer blogs. Instead, my husband would read them. He would use the blogs to give me suggestions or provide me with more information about what it was that I should be looking up next or what I should be expecting. He became my filter for information on the internet, in guiding me into places I needed to be, but also protecting me from the information I wasn't yet ready to receive. One of the loved ones in the anonymous survey writes, "My partner was diagnosed with breast cancer in 2010. I started reading blogs of women who initially had her exact diagnosis, ductal carcinoma stage 2B, one positive node, who had gone on to have recurrence and stage 4. I had the idiotic idea I could prepare myself for what might be our future." I really wish I knew who that was so I could reach out to them, but it was an anonymous survey. As demonstrated by the quote from a reader of my blog, the blog helps her better understand what her sister might have gone through. I should note that when I have names, I have permission from the people. They left public comments on my blog, but I also reached out to them to get permission to use their quotes in this presentation. Okay. So why do patients read breast cancer blogs? If you're not in a major center, not in a place where there are good face-to-face support groups, online communities help fill the gap. Survivors turn to blogs and social media communities, Twitter or Facebook, to share their stories and to help get a feeling that they're not alone in their journey. One survivor says she read blogs to feel a sense of community and validation. Another says to help cope with my diagnosis. Among those who read blogs, there's a subset of people who actually leave comments on blogs. Sometimes they're bloggers, but other times they're people who read your blog and feel a connection with you. One example is this connection is Diana, who I've never met in person. I don't know, we've actually only pretty much interacted over my blog, and yet she leaves very, very powerful comments. Becky, I feel a gratitude to have a place where I can acknowledge breast cancer impacted my life, and my family and my friends' lives. The way you write encourages me to think, share, process, feel, and you provide a safe space for a special listening and desire to understand and relate. This feels like a sacred place to explore and investigate options and decisions making, and just being on a journey or in a community that has a special consciousness. It feels non-judgmental and okay to be real, whatever that may be. I'm honored to be part of your community, and thank you for sharing your blog with us all. Diana. So, to the healthcare practitioners, there were a few that actually did respond and were part of this. I should show this picture. At the end of chemo, they sing a chemo song. The chemo's done, and so this is the nurses singing me the chemo song. One of my goals in writing the blog is to help provide context to healthcare providers. I'd hope to hear more physicians and nurses reading my blog, but the numbers are not as much as I'd hoped. In my own experience, the health professionals that read my blog are the ones that interact with cancer patients, but not those that directly treat them. That is, I have received comments regularly from my dermatologists about my blog, but not from my oncologists. And I thought that was kind of interesting. My cousin, who's also a nurse, says, "I'm following along with you daily now and have been since you first mentioned your blog on Facebook, finding it so helpful in understanding your journey medically, spiritually, and emotionally. Thanks for sharing." And one health professional says, "I'm a breast cancer advocate, and the blog gives me another window into the lives of the people we serve. They're especially helpful after the release of new treatments because bloggers talk about the real morbidities of treatments, not just the ones reported by pharmaceutical companies. The most helpful blogs on metastatic breast cancer help me understand day-to-day life with stage 4 disease." I thought that was particularly interesting, the part about the pharmaceutical companies and whatever, because it's a big debate that happens quite regularly in the breast cancer community about side effects of the different treatments and the fact that we're not told about them until they happen to us. Before my diagnosis, I had not heard of the term ePatient. I had no idea what it meant to be an engaged patient. I had no idea how to advocate for myself within the medical healthcare system, or even that I needed to advocate for myself. Part of me struggled with culture shock, a real lack of familiarity with this system. In reality, it didn't matter that I was in a new country and a new, totally different healthcare system. I would have been just as lost navigating the world of breast cancer patient in Canada as I was in the US, because both were so familiar. I was lost in an unfamiliar landscape. One of the questions I wanted to answer about blog impact is whether or not blog readers felt that reading blogs helped improve how they advocate for themselves. When asked if reading blogs had helped advocate for oneself, 68% said yes. This number was slightly higher for those when I included only those that had a cancer diagnosis. It was up to 75% that reading blogs had helped them advocate for themselves. One person commented, blogging about breast cancer and reading others' blogs has helped me feel more empowered and less alone. I feel more skeptical of treatment claims, and I feel like I really need to do my own research to figure out what's best for me. Being an engaged patient who gets information from blogs and social media is a bit of a double-edged sword. Views can be distorted by the voices of those who are sharing. Perhaps they're more extreme, is one of the questions I have. Personally, I look at my blog and I try to capture both the good and bad. However, it can be really easy to fall into the trap of only writing about the bad stuff. We can think of ourselves, we think to ourselves that the good stuff is not blog-worthy. Saying, I had a normal day, doesn't feel like it's worth writing out, and yet as a survivor in active recovery, a normal day is what I strive for. One respondent comments on the negative impact of reading breast cancer blogs. Sometimes I wonder if I should continue to read. On the one hand, it informs and helps me. On the other hand, reading about the misery of others can make me depressed. So this survey has just touched the surface on ways in which breast cancer blogs impact patients, family and friends, and healthcare professionals. When I mentioned this study and hopefully my new dissertation study to my surgeon, she commented that she had to deal with the fallout from patients who read blogs. So although she herself did not read cancer blogs, she is impacted by those who do. This highlights to me that more research needs to be done and looking at the impact, not just from the patient perspective, but also from the healthcare perspective and healthcare team perspective. There are many positive impacts to breast cancer blogs, including the increased sense of patient advocacy. However, there are some negative impacts, including additional patient anxiety and fear. This study also did not look into the depth of breast cancer blog on caregivers. I actually, on the demographic question, forgot to ask if people were caregivers. I just asked if they were relatives. And so there was sort of that, missing a bit of a gap in the survey there. So with this survey, I feel like I just scratched the surface of ways in which breast cancer blogs impact people who read them. I'm looking forward to further discoveries. Thank you.